Your answer is?
Yes, for sure.
But in America, the drug companies say they aren't so sure that importing drugs from country to country really is safe. Pfizer, the drug company Peter Rost works for, declined to talk to us about Rost, but Pfizer's Vice President of Global Security, John Terrio, did tell us that importing drugs is potentially dangerous.
The position that we take is that the more times a product changes hands, the more opportunity there is for the introduction of bad medicine.
Some people might be skeptical of your saying it's not safe to import drugs from overseas. You do work for Pfizer, and all the drug companies tend to lose money if drugs are cheaper.
I'm not making a pricing argument today at all, but I don't think that patient safety should be sacrificed for affordability. I think there needs to be a solution to this problem, but opening the floodgates to product from all over the world really enter the U.S. market, I think, is a mistake.
Clearly, this is a matter of profits. It's not necessarily a matter of safety. I mean, I think it would be derogatory to claim that Americans would not be able to handle reimportation when the rest of the educated world can do this.
How many cases of death or serious disease have there been due to this practice?
There is none known due to this practice.
So it works?
It works very well.
Has anyone been hurt by taking a bad drug because of parallel trading?
I don't know that anyone has, but the point is that we're making the safety issue before that happens.
My job is to ensure the safety of the American public.
Dr. Richard Carmona is the Surgeon General of the United States. He recently chaired a task force to study drug importation, which concluded that building a safe system to do it in the U.S. would be difficult and very expensive.
It could be done. The evidence that we have says it could, but the cost to do it, the additional regulatory authority necessary, the hiring of more people, then you have to step back and say, well, is that cost going to outweigh any savings benefit that we provide the American public? And that's a very tough one.
Why are drugs so much more expensive in the United States than they are in almost any other country?
The United States does a lion's share of the research in the world for research and development of drugs. So it's why the Canadian government sells it cheaper. They don't have the overhead.
See this pill? I helped invent it.
The Surgeon General's task force report agrees with the pharmaceutical companies that if they lower their prices, they'll spend less on creating new drugs, on R&D. Peter Rost doesn't buy that argument. He says drug companies won't cut back on research and development because it's their bread and butter. They have to develop new drugs, or they won't have anything to sell when the patents on their existing drugs expire. He recently testified before a Senate committee, urging Congress to pass a bill legalizing the importation of cheaper drugs from overseas, even though his own employer is against it.
Stopping good reimportation bills has a high cost, not just in money, but in American lives.
Yeah, Dr. Rost, do you still work for Pfizer company?
Yes, I do. Yes, I do.
Pfizer, however, claims that Rost lacks the credentials to say anything about importing drugs from other countries. The company sent a letter to the Senate committee saying, "We have no basis to support Dr. Rost's purported expertise in this area." Pfizer also sent 60 Minutes a letter saying, "Dr. Rost has no substantive grasp of how importation threatens the safety of the U.S. drug supply."
It's an attempt to discredit me, and they should have known better because they know that I have a lot of experience in this area, so it's completely wrong, and they knew it. I mean, you have an insider who knows how things really work, who has lived this.
When you go to work, what kind of response do you get from your co-workers?
The majority of the feedback has been basically treating me like a sinner, somebody who has fallen from the righteous way.
Ross works from home a lot now. He's still employed by Pfizer, but he's not sure how long that will last. Do you ever look around at this lovely house of yours and wonder what might go away?
Every day.
The bill has been introduced in the Senate that, if passed, would allow the United States to import cheaper drugs from other countries, just as they do in Europe. The pharmaceutical industry opposes it, but the large drug companies have announced they're expanding their programs to offer low-cost drugs to the poor.